I've heard these folks described as illegal aliens, people that have crossed the border illegally. Are they asylum seekers, or are they in fact people that have crossed the border illegally?
Yeah. I can address that item from the information that the state has provided to the community. And what their material says is to be eligible for the shelter under this program, at least one household member must be a citizen, a green card holder, or be present in the U.S. with the knowledge and consent of the Department of Homeland Security, meaning individuals have made lawful entry into the United States. Only families with lawful entry are eligible for the emergency assistance program.
Hold on a minute.
And that is information.
If we're going to hear all this background noise, people aren't going to be able to hear. Plus, this gets recorded, so it's going to interfere with people that want to see this at a later date. What is the source of that information, Bob, that you just read?
And this is a briefing from the Department of Housing and Livable Communities.
So this is from the state?
It's from the state, yes.
Okay.
I've also heard that the folks have been given large amounts of money to spend at various stores. If this is true, how much have they been given, and what is the source?
No, Cash, we have been informed that they are participating in the WIC card program.
Right.
But
do we know who is providing those meals to the population?
So that is contracted by the state from an approved commissary. I don't have the name of the restaurant, but I have seen them being delivered. They're labeled lunches and dinners. 2 bags are dropped off, and they're immediately then picked up and distributed into each of the rooms, placed into a refrigerator. I can get you the name of the restaurant, but it's coming from an approved commissary, meaning approved commissary, a licensed restaurant.
Well, and because there was some comments being made of the school department delivering meals, but these are coming from...
Not to my knowledge, no.
So they're having their lunch and dinner delivered. Breakfast is on their own?
The hotel owner is providing some light, some fruit, some things. It's just a kind of a grab and go, if you will.
Okay.
It's not being delivered anyway. It's being put out for them, and that's being put on and provided by the hotel owner.
Have we checked to be sure that there aren't any illegal cooktops or anything of that nature, kitchen-related, in these homes?
I have not personally gone in and out of each of the rooms, but through the building commissioner, that is not allowed. The owner, we had the owner, when this was early on, first week, letting them know they're not in the suites. As you face that building, as you face that facility, to the left of where the suites are, and there are kitchenettes in there. Mm-hmm. That's where the nurses are. That's where the guardsmen kind of station. That's where they operate out of. The migrant families are not in that section. This is in the main complex. That's where they're housed. There are no cooking facilities there.
Okay, when you say no communicable diseases, in the case of all the school-age children, they've been properly vaccinated with the requirements for the school department? No, that's not true. There is a process to that. Now, by federal law, McKinney-Vento, as you know, a homeless individual can start school immediately. This happens. This is not unique to this cohort. Mm-hmm. They can start immediately, and then there's a process to that. And some have been fully vaccinated. Mm-hmm. But the medical response team is cataloging that. Some individuals came from just outside of Boston. All their medical records were there. They just need to get them down here. Mm-hmm. In the school department, the nursing supervisor has been visited the site multiple times, and they're working through that. But it does take a process, but they do go into school immediately. The difference is that there was an assessment. So when you're doing an assessment, they're making sure the symptoms, whether TB, it might be fever, night sweats, cough, things of that nature. Well, there would be a contraindication that further medical treatment is required. It might be a chest X-ray. It could be a skin implant for TB, if those are the things, pertussis and others. That was evaluated. You put them into school, and this happens. This isn't unique to this group, and then the immunizations begin. the state has hired the vendors to come in and do vaccinations at each of the site, and we share that. Bob has put that up on the site. And for the community to understand, please check the website. Updates are going on, and press releases, as he mentioned in his presentation, are going up every couple days. Once we confirm it through the state, and we get information or actually medical information, census, things of that nature, it goes immediately. It's the best way to channel information. Otherwise, scattered and imperfect data, it creates sometimes fear and misinformation. That's not the best way. Bob has put a system in place for the website, and it's going up, and it's talked about each morning that we say, what's the next update? What do we have? What do we have for information so the community can understand?
So a student gets admitted to the school. Let's say a young student, a kindergarten, first grade, second grade, and they don't have to get any immunizations to get admitted, but do they have to get any after that?
Yes, there's a process.
What shots do they have to get?
I can get with the nursing, what exactly, polio, malaria, pertussis. There's a list of vaccinations that happen.
TB?
TB, yep. Well, no, there'd be monitoring for TB. That's all. There wouldn't
It's not a required inoculation?
Not that I'm aware.
Okay, so can you get a list of what those inoculations are?
I can.
And can you also get us a list of any communicable diseases that were diagnosed by students that, other than what's required for inoculations? So, for example, if TB is not required, I don't mean today, because you've been clear that there's no incidence of communicable diseases, but that can change over time.
It can.
Or you might have symptomatology that hasn't manifested itself that night, a week from now, or 2 weeks from now.
There is an incubation period.
3 weeks from now.
You're right.
So is there any monitoring of that?
Well, there is. There's a school nurse that would be looking at that.
One school nurse for all the schools?
That is the system in place as far as if a student or a staff member or anyone in our community, if they present at an urgent care or a hospital or primary care, that's where the communicable disease reporting happens. That's the network that's in place.
Okay.
Students don't. I mean, if a family member, they wouldn't self-diagnose. It's done through a medical professional. That's how the reporting happens.
You mentioned that there was 2 nurses there from the medical response team when you went. How often are they at this facility screening people?
So that's a great question. They were going to stay there until I went back on. That was on Tuesday, the first Tuesday that they were there. They arrived on Sunday. I went Tuesday morning. I went back on Thursday. They were there again. I asked them. They said they were going to stay. 2 RNs were there until everyone has been profiled and cataloged for their medical needs. Now, I didn't bump into them again. I never saw them again. They may have been there. They were going to stay until everyone, their charge was to make sure everyone has a medical assessment. But they were there within 48 hours of individuals. And again, at that point, it was a small census. It was the first phase of individuals coming.
I think there was like 6 families or something initially.
Your first meeting, there was a concern. There is no medical on site. As a matter of fact, there was medical on site.
Has the school department at all indicated that there are any financial issues or burdens that they'll need extra help on? Or have we gotten any sense of that?
I discussed that issue with the school business administrator this morning, and he indicated that if the reimbursement funds follow through, that should be adequate to address the needs of this population.
Okay. And that we're talking about, I mean, that's all inclusive in terms of all of the types of services that they might need to provide.
Correct.
Okay.
Bob, when you talk to the school about the reimbursement and versus our cost per student, and it's a few $1,000s short, and let's say probably more than 2 and less than 3,000 per capita. Does that include special education, or is that a separate category of expenses that would not fall within that calculation? Do you understand what I'm saying?
Yeah,
In other words, there's a reimbursement based on the average cost per student in the state, which is short of our cost per student. Or putting it another way, our cost per student exceeds the average cost per student in the state. Does that factor in
it is.
special education, which is a real budget driver, and does it factor in care for the medically fragile, which sometimes is a huge cost?
So those costs are calculated on an average basis over the entire population. So they are inclusive of some special education costs, but it's not comparing, like if you say that 100% of this group is special education. No, it's averaged among all of the students. So,
But it would include special ed?
Yes.
As far as you know, okay.
Is there any evidence at all that, we've heard that the homelessness problem is a serious one, and it's not just in terms of migrants, but there are also local residents that are homeless. Is there any evidence that there's an effort underway to house people that have either been displaced, like from Yarmouth resorts or any other non-migrant populations? Has there been any communication that there are plans underway to maybe find space for Yarmouth residents or local folks?
Through the chair, that's a great question, and that's one of the concerns being that those are vulnerable populations, not just the migrant families, but across homeless individuals, whether they're chronic or just recently dipped into for a number of different reasons, medical reasons, foreclosures, job loss. That's a vulnerable population, and they also need to be attended to. In no way, if there are, to answer your question, if there are plans underway, I haven't heard them.
With the Yarmouth Resort, there was some suggestion in the media that people had been displaced in furtherance of this program going into the Yarmouth Resort. We know that the program didn't go in there, but do we have any evidence that people have actually been displaced in either setting?
I don't know what the census was, or if they had to empty out that would be speculation. I have to find that out.
You're not
I don't
aware
know.
of it?
I'm not aware of that.
Okay.
Well, I spoke to the reporter that did the story right after the stories came out. The reporter insists that they're pretty confident in that information of at least 35 people being displaced. I find that to be reasonable information. Would I go to court on it? I don't know. But she seemed pretty confident that there was a sizable number of people that were displaced.
I can find that information. Each time I go, most of the time they come over, the manager will come over, and with the cell phone, put me on the phone with the owner of the facility. That's a question I can just ask. We're individual. I haven't asked that. I haven't asked that question.
I would be surprised if...
That article was back in August, wasn't it, Mark?
That article was... in August, in early August, there were two articles.
Cape Cod Times in
There were
August.
two articles in the front page, Cape Cod Times, and one of the people that were displaced, was literally a photograph with a copy of a notice indicating that the rent was going up to an exorbitant amount. I think it would be helpful to try. I don't think it's going to be easy, given the source that you identified. You try to get that information. But I think it's certainly worth pursuing from whatever sources you can. I think this has been an issue that we raised from the very beginning when the very first call from the administrator to the governor's office. I think they made it very, very clear that, we're dealing with an establishment that was very quick to put people out on the street in order to cash in or make room, for this for a larger number of folks coming in. And obviously, when that was expressed, I think that was one of the red flag issues that, put a time out on it. I do think it's fair to speculate that if there are other similar facilities being pursued, who's to say that activity might not be happening in other places? That's the reason why the state needs to have tighter controls in terms of how this program runs. We just know of one facility where there's been displacement. What other, where might there be other problems?
Right.
So I think the concern is a legitimate one.
Right. No.
So, you're housing X amount, but then again, displacing X amount. I mean, what are we really accomplishing?
Many times public health is in the situation of immunizing the community with good information, right?
Right.
We're trying to immunize with good information. How we communicate and engage and educate the community is many times the measure of success. I hope today's presentation from the town administrator, from the Department of Public Health, gave some assurance to the community that there are safeguards and there's surveillance in place. It's not a perfect product by any means. I understand the emotion that's going on, but it is being watched. For the residents that are there, very vulnerable population, and the community at large, there are safeguards in place. And that education and information, and we'll call it immunization that goes on with information, that'll continue.
Well, like Mark's alluded to before, as long as this thing is developing, as long as we're getting more information, we're going to keep it on the radar screen in terms of our agenda, and so that we can, let the public know everything that we know.